No bills, no responsibilities, no stress, right? Wrong, at least based on the findings of a recent study that assessed the functioning of Bahamian citizens and residents for a 30-day period. This included the 5-day extended lockdown during Easter ending May 29th. A survey of 700 participants, mainly women, found that there was an increase in stress due to the COVID-19 pandemic. Those who suffered from loss of or reduced were at higher levels, further influencing stress levels being female, younger, and a frontline worker in the crisis. But that's an expected finding. What about the unexpected?
So we found higher rates of stress with our younger participants. And we thought that this was particularly interesting because we would think that the stress that people were reporting was in some way related to catching the disease. But those that were at least risk reported higher rates. So we think that that might have to do with the stress being related to other factors, not necessarily just COVID.
Research has found that those added factors may very well include uncertainty about their education, economic prospects, and the stress of another hurricane season following the disaster of Dorian. These combined with the added stress of an already uncertain future. Here's UB's Dr. Stephanie Hutchinson.
I think then that means that policymakers, not just in terms of thinking about mental health, but also recognizing that that particular demographic might have special needs and that need to be creative in seeing how we can address those needs as well. I constantly refer to utilizing the resources that we do have available, and we do have local resources available, but I don't know how much people access those resources. Something just as simple as calling into the hotlines that have been repurposed from Dorian, so that people can have a point of access, a very simple point of access to just call in and talk to someone about what they may be struggling with, what they may be coping with, is a community-based resource. That one step that we can take. And then we have a number of health professionals who are very sensitized to what's going on and are part of the frontline workers in the trenches, even though we may not be thought of as such.
And as for what that stress level may look like now, after all things have returned to normal, but thousands are still cash-strapped.
What I'm finding with myself, and I think with others, it's like re-entry has its own stressor because we've been locked down for so long. We've made adjustments, even though we don't realize it, to what was happening with the lockdown and restrictions. And so going back to work, being in environments where we have to be socially distanced and people are more present and people have maybe a more sensitized to, now can I really catch it because I'm out in the community? And so I think reentry may be a cause for stress that people may not have taken into consideration.
Our environment has changed, right? We keep talking about going back to normal, but we have to admit that what was considered normal is now, in some ways, completely different. The fact that we have to now wear masks, for example, when we go out, is an example of the change that we have to commit to in our society. And anytime people are forced to change or change occurs, it can be accompanied with stress. So in terms of coping, some of the things that we have to try to do is recognize that these are real changes, right? That we are going to feel that adjustment, uneasiness, or maybe anxiety, but also try and understand the things that we can control in our environments,